Polycystic Ovary Syndrome, or PCOS, is a hormonal disorder that affects women. It is one of the most common endocrine disorders among women of reproductive age. PCOS is characterized by an imbalance of hormones, leading to various symptoms that can impact a woman's physical and emotional well-being. While the exact cause of PCOS is unknown, it is believed to be a combination of genetic and environmental factors. Despite its prevalence, PCOS is often misunderstood and misdiagnosed. Many women with PCOS remain undiagnosed for years, unaware of the underlying cause of their symptoms. The good news is that with proper diagnosis and management, women with PCOS can lead full and healthy lives. PCOS manifests itself through a range of symptoms, often beginning in adolescence. One of the most common symptoms is irregular periods, which may be infrequent, prolonged, or completely absent. Another hallmark symptom is hyperandrogenism, an excess of male hormones called androgens. This hormonal imbalance can lead to acne, excess hair growth on the face, chest, or back, known as hirsutism, and male pattern baldness. Weight gain or difficulty losing weight is also common in women with PCOS. Insulin resistance, a condition where the body's cells do not respond properly to insulin, is often associated with PCOS and contributes to weight gain. Other potential symptoms include fatigue, mood swings, sleep disturbances, and skin changes like darkening of the skin in certain areas, known as acanthosis nigricans. While the exact cause of PCOS remains unclear, research suggests a complex interplay of genetic predisposition, hormonal imbalances, and underlying inflammation. Family history plays a significant role, as women with a mother or sister with PCOS are more likely to develop the condition. Hormonal imbalances are central to PCOS. Excess androgens, primarily testosterone, contribute to many of the symptoms, including acne, hirsutism, and irregular periods. Insulin resistance, another hormonal factor, is present in many women with PCOS, further disrupting hormone balance and increasing the risk of weight gain and type 2 diabetes. Chronic low-grade inflammation is also implicated in PCOS. Diagnosing PCOS involves a comprehensive evaluation of a woman's medical history, symptoms, physical examination, and laboratory tests. There is no single test to diagnose PCOS, and healthcare providers rely on a combination of factors to make an accurate diagnosis. A detailed medical history, including menstrual cycle patterns, family history of PCOS, and any other health concerns, provides valuable information. A physical exam allows the doctor to assess for physical signs of PCOS, such as acne, hirsutism, and obesity. Blood tests are essential to measure hormone levels. An ultrasound may be performed to examine the ovaries for the presence of cysts and assess their size and number. It's crucial to seek care from a healthcare provider experienced in diagnosing and managing PCOS. Section 5. Treatment options, medication, lifestyle changes, and holistic approaches. Treating PCOS involves a multifaceted approach that addresses both the symptoms and underlying causes. Treatment plans are individualized based on a woman's specific symptoms, health goals, and whether she plans to become pregnant. Medications are often prescribed to regulate periods, reduce androgen levels, and manage insulin resistance. Oral contraceptive pills, or OCPs, can help regulate the menstrual cycle, reduce acne, and minimize hirsutism. Anti-androgen medications can further reduce excess hair growth and acne. Metformin, a medication typically used to treat type 2 diabetes, can improve insulin sensitivity and lower blood sugar levels. Lifestyle modifications are crucial for managing PCOS. Weight loss, even a modest 5 to 10%, can significantly improve insulin sensitivity, regulate periods, and reduce androgen levels. Regular physical activity is another cornerstone of PCOS management. Section 6. Living with PCOS, personal stories and experiences. Living with PCOS can be challenging, both physically and emotionally. Many women with PCOS experience frustration, anxiety, and even depression due to the condition's impact on their bodies, self-esteem, and fertility. For years, I felt like I was fighting my own body, shares Sarah, diagnosed with PCOS at 25. The weight gain, the acne, the irregular periods, it was all so overwhelming. Another woman, Emily, recalls her struggle with infertility related to PCOS. Trying to conceive was heartbreaking. These personal stories highlight the emotional toll PCOS can take, Sharing experiences with others, whether through support groups, online forums, or with trusted friends and family, can provide a sense of community and understanding. Section 7. Managing PCOS through diet and exercise. Practical tips for a healthier lifestyle. Diet and exercise are not just treatments for PCOS. They are essential lifestyle changes that empower women to take control of their health. A PCOS-friendly diet focuses on nutrient-rich, whole foods that help balance blood sugar levels, reduce inflammation, and support hormonal health. This includes plenty of colorful fruits and vegetables. Aim for at least 5 servings per day. Whole grains. Choose brown rice, quinoa, oats, and whole wheat bread over refined grains. Lean protein. Include fish, poultry, beans, lentils, tofu, and low-fat dairy in your diet. Healthy fats. Incorporate sources like avocados, nuts, seeds, and olive oil. It's equally important to limit or avoid foods that can exacerbate PCOS symptoms. Sugary drinks, soda, fruit juice, and sweetened beverages spike blood sugar levels. Processed foods. These often contain unhealthy fats, added sugars, and artificial ingredients. Regular physical activity is crucial for managing PCOS. Section 8. The importance of emotional well-being. Coping with PCOS and seeking support. Living with PCOS can be emotionally challenging. The physical symptoms, hormonal imbalances, and potential impact on fertility can take a toll on a woman's self-esteem, body image, and mental health. It's essential for women with PCOS to prioritize their emotional well-being alongside their physical health. This includes engage in activities that bring joy and relaxation, such as taking a warm bath, reading a book, spending time in nature, or pursuing hobbies. Explore stress reduction techniques like yoga, meditation, deep breathing exercises, or spending time with loved ones. If you're struggling to cope with the emotional impact of PCOS, don't hesitate to seek professional help. Section 9. Complementary and alternative therapies. Exploring additional options for PCOS management. In addition to conventional medical treatments and lifestyle changes, some women with PCOS find relief and support through complementary and alternative therapies. Acupuncture, a traditional Chinese medicine technique, involves inserting thin needles into specific points on the body to stimulate energy flow and promote balance. Some studies suggest that acupuncture may help regulate periods, reduce androgen levels, and improve insulin sensitivity in women with PCOS. Yoga, an ancient practice that combines physical postures, breathing exercises, and meditation, can be beneficial for PCOS management. Herbal supplements are also sometimes used to manage PCOS symptoms. While complementary and alternative therapies can be valuable additions to a PCOS management plan, it's essential to discuss these therapies with your healthcare provider to ensure they are safe and appropriate for your individual needs. Section 10. PCOS and fertility. Understanding the impact and exploring treatment options. PCOS is a common cause of infertility in women. The hormonal imbalances associated with PCOS can disrupt ovulation, making it difficult to become pregnant naturally. However, it's important to remember that having PCOS does not mean you can't have children. If you have PCOS and are trying to conceive, your healthcare provider can recommend various treatment options to improve your chances of pregnancy. These may include, even a modest weight loss of 5 to 10% can significantly improve ovulation and increase the likelihood of conception. Clomiphene citrate, Clomid, and letrozole, Femara, are medications that stimulate ovulation. Section 11. A message of hope. You can live a full and healthy life with PCOS. Receiving a PCOS diagnosis can feel overwhelming, but it's essential to remember that you are not alone and that there is hope. With the right knowledge, support, and self-care practices, you can live a full and healthy life with PCOS. By understanding your condition, working closely with your healthcare provider, making healthy lifestyle choices, and prioritizing your emotional well-being, you can manage your symptoms, reduce your risk of complications, and achieve your personal goals. What works for one woman may not work for another. It's essential to listen to your body, be your own advocate, and find what works best for you. Embrace a positive mindset, surround yourself with a supportive community, and celebrate your strength and resilience.